Hello, this is an education module on improving clinical decision-making through high-fidelity simulation by Carolyn, Graham, and Sarah. Our PICO question. The clinical problem is that clinical decision-making errors contribute to patient safety events in the healthcare setting. These mistakes arise from insufficient training, inadequate experience, or outdated knowledge regarding the presented situation which the medical staff may not have encountered previously. The population focused on are healthcare students and providers. The intervention is high-fidelity simulation. The comparison is didactic lecture-style education. And the outcome is improved decision-making leading to an increase in patient safety and minimal errors. Learning objectives. By the end of this learning module, students should be able to describe the purpose of high-fidelity simulation in healthcare education compared to in-lecture didactic learning. They should be able to explain the key components of simulation that contributes to improved outcomes in education and in the clinical setting. Lastly, the student should be able to identify the key benefits of high-fidelity simulation. Background of the problem. 16.8 million adverse events occur in the medical care each year, which makes healthcare errors the third leading cause of death in developed nations. Providers experience high levels of stress and cognitive overload because of patient and situation complexity. Clinical scenario learning is largely dependent on case exposure during clinical rotations, which may vary widely across individual learners and clinical sites. Without exposing all participants to the same complex clinical scenarios, many students may be missing pertinent information that will be beneficial in their future careers. Review of literature. Across multiple randomized controlled trials, students who participate in high-fidelity simulation education achieve higher scores on clinical decision-making and skills than those in control groups receiving standardized didactic instruction. Along with the enhanced clinical decision-making skills, high-fidelity simulation produced significant improvements in self-efficacy, applied skill performance, and student confidence as medical providers. High-fidelity simulation-based learning may be more effective than traditional teaching methods for improving theoretical knowledge, clinical reasoning, and skill acquisition, especially in areas such as trauma and neonatal resuscitation. Solution to the problem. High-fidelity simulation provides realistic clinical scenarios such as cardiac arrest, laryngospasms, neonatal resuscitation, respiratory arrest, and many more. It also provides an environment to practice decision-making without the risk to real patients in a controlled, monitored environment where students can practice their skills and enhance decision-making. Immediate feedback from instructors during a debriefing session where students may ask questions and receive constructive feedback. It also provides a setting of repetition of clinical skills and rare high-risk scenarios. Key takeaways. Clinical decision-making is paramount for patient safety in the healthcare setting. High-fidelity training aids in exposing students to clinical scenarios in a controlled environment without the risk of patient harm. It also provides a setting for constructive feedback and debriefing sessions for students to understand ways in which decision-making went wrong. Simulation has proven to improve confidence, decision-making, self-efficacy, theoretical knowledge, and skill acquisition. Incorporating high-fidelity simulation into healthcare education can improve training outcomes and enhance patient safety in the healthcare setting.